Hello and welcome. My name is Tazim Virani, and I am the Senior Vice President for Social Impact and Global Initiatives at SE Health. First, let's begin by acknowledging the land that we are on today. We respectfully acknowledge that the city of Markham, where I am right now, is situated in the traditional territories covered by Treaty 13 Toronto Purchase in the lands of the Haudenosaunee, Huron-Wendat, Anishinaabeg, Seneca, Chippewa, and the Mississaugas of the Credit First Nations peoples. We gratefully acknowledge and respect the treaty, unceded traditional territories, and ancestral lands where we live, love, and work. We are inspired by SE Health's purpose to bring hope and happiness, and our longstanding commitment to collaborating with First Nations, Inuit, and Métis communities and organizations across Canada, which honors and respects and acts upon the work of the Truth and Reconciliation Commission. As this meeting is virtual, I encourage you to explore and reflect on which Indigenous lands you are currently on, and invite you to introduce yourself in the chat, as many of you are already doing, and feel free to share where you are calling from today. So today we are excited that you've joined us for Designing the Future, Scaling Innovative Housing Options for Older Adults. We've had 600 people that have registered for this event, which was actually our maximum. And we have a range of attendees from sectors such as healthcare, housing, government, and finance, as well as our own SE Health leadership. Before we dive in and hear from two very exceptional panels, I'd like to invite us to do a little dreaming. Can you imagine housing for older adults that maximizes independence, fosters community, hope and happiness, and is affordable? What would that look like for you? In the face of a rapidly aging population, Canada faces systemic barriers that starkly impact our older adults. Chief among these is the lack of innovation and support to spread more age-inclusive housing models. Many older adults lack housing options that meet their health, social, and financial needs and preferences. Over 1 million Canadian older adults live in unaffordable housing, and 35% do not receive adequate home care. This reflects a significant systemic barrier, the barrier of the disconnect between affordable housing, health, and social care. So as one of Canada's largest nonprofit social enterprises, SE Health is best known for home and community care and providing services in seniors living. But we work across diverse sectors nationally. With over 115 years of experience providing quality care for older adults in their homes every day, we understand that a key social determinant of health, access to housing, is health. As a social enterprise, our areas of impact include Indigenous health, end-of-life journeys and hospice, and the future of aging. Over the last decade, SE Health has been committed to exploring the question, how might we increase the supply and range of housing options available for Canadians? And we've collaborated on projects like Building with Mission to facilitate more age-inclusive, affordable housing development, and created coalitions like Courage, Action for Better Aging, to advance models that connect housing, health, and social care. SE Health's current housing initiatives include small care homes, which you'll hear more about today in the first panel. And we've also been exploring workforce housing and opportunities to support our healthcare staff. So we've created this event and invited you all here because there has never been a more important time to consider increasing innovative models of housing for older adults. Older adults have unique needs, and we must offer diverse, flexible options where they are part of that co-design. It's time to go beyond showcasing models, and we need to focus on implementing strategies to spread these across Canada. And I believe collaboration is really critical to doing this. Today, we're bringing together advocates, healthcare organizations, planners, funders, government, housing developers, other allies to help design the future of housing for older adults. By attending this event, you are already part of that solution to spread and scale these models. And thanks to all of you who have provided us questions in the registration form. We have, included that in our discussion panels. But with time constraints, unfortunately, we won't be having a live Q&A. Throughout this event, we invite you to share your thoughts in the chat, engage with other attendees, and share what resonates with you. I'm going to now pass it over to my colleague, Lindsay Cox, who is our Director for Future of Aging Affordable Housing at SE Health, to kick us off with the first panel.
Thanks, Tazim. First, we will hear from Dr. Louisa-May Khoo. Dr. Khoo, your work in urban planning has supported Singapore in becoming an exemplary model for aging well and a recently named Blue Zone, an area recognized for the longevity of its residents. You're now bringing your insights into the Canadian context as an urban planner in British Columbia. Can you share some examples of the aging and policy work that's been done in Singapore and the unique housing models being piloted?
Yes, thank you very much. And thank you to Tazim and her team for having me. I am really it's indeed a privilege to be among such luminary company. I would like to begin by first acknowledging that I am zooming in from the city of Maple Ridge on the traditional, ancestral, and unceded lands of the Cathy and the Kwantlen First Nations, who have been stewards of these lands since time immemorial and where I am an uninvited guest. And I think Tazim has set the stage very well, but let me add a few more elements to the horizon in front of us. So we are on the verge of witnessing the most extraordinary flip, I think, in human history, where the number of older adults will outnumber younger people. Alongside this changing demography, we are also seeing rapid planetary urbanization at scales unprecedented, whether that's global cities like Singapore, Vancouver, and Toronto, or smaller cities like Maple Ridge, where I am. At the same time, we have improvements in healthcare, medical science, which has meant that people can lead longer lives, which is a great thing, right? Life expectancy is about 82 to 85 years now, and a third of these older adults will live well into their 90s. But are our systems enabling us to thrive in quality-driven ways in our older years? So I believe that the ways in which we think and do aging planning and elder care has to shift, right? It's no longer a small percentage of population living in purpose-built retirement villages, but a quarter to a third of this population who are now older adults. So to translate this demographic for you in layman terms, it means every fourth person we meet on the street would be over 65 years. Almost every other household will have an older adult living in it. So how we plan for longevity, how we care as a super-aged society has to be fundamentally embedded in the governance structures, in integrated planning, and really in our civic ethos, right, to care. So Singapore reached this demographic that I spoke about will reach this demographic by 2030. Canada has another decade by 2040. And so about a decade plus ago, there was a marked policy shift in Singapore. Singapore had prior to that believed that the state ought to take a back seat because aging is a personal responsibility. It's something that is taken care of within family circles. And I believe that's kind of still the paradigm here. But as they saw the scale ramp up, they soon realized that they needed to do more, that this was no longer a sustainable approach. And so a lot of direct intervention was needed by the state to shore up elder care needs across all realms. So whether it's financial, medical, social infrastructure. So in the public sector, it was all hands on deck. It was really, they set up an aging and interministerial committee with 3 ministers. They set up an agency of integrated care, which was a one-stop shop, a public agency that was fronting all the senior work and all the elder care so that the public had a one-stop shop to go to. And really elder care centers were doubled, nursing beds were doubled to care for our seniors, right? And on the housing front, a new model was introduced. So like what we have here, there was a missing middle where you had the very high-end private retirement homes that nobody could afford. And then you had the publicly funded ones, which had long waiting lists, right? And so they introduced something called the community care apartments, which was a partnership between the Public Housing Authority, so subsidized housing, yeah, and the Ministry of Health. And they offered a concierge service within the seniors housing that combined housing and care. So the services could be scaled up as you age. So think of it like a butler service where you could top up and various tiers of service packages to get more services as you needed them. But the beauty of this was it was provided on site, right? Like you didn't have to go out and trot to all sorts of places to get them. So the public housing built the apartments, the Ministry of Health operationalized the care services. So I think that's something more of such innovative models that we could look at. Yeah, and maybe I'll just stop there and let Lindsay jump in.
Thank you, Dr. Khoo. My brain is swimming with these ideas, and thanks for sharing the links that we could share with the attendees. So we posted those in the chat. More information on the work in Singapore. And so, from your urban planning perspective, how can Canadian governments and communities better plan for longevity and support more innovative housing models for older adults? How can we bring some of that knowledge from Singapore into our Canadian context?
I think first, really moving from conversations to actual doing. You don't have much time left. You really need to be bold in testing out new models, testing out policies and regulatory measures that can help both kin and kith, right, support the care needs that will come along. Being a lot more aggressive, a lot more strategic, a lot more shrewd, I think, in the ways we advocate for change. Like use the data you collect, the stories you hear, make these work for you. Make sure they're ammunition to show policymakers the urgency, the whys, and the how-tos, right? Because the latter is the most important. And oftentimes we go, I think, to funding agencies with the problem rather than the solution. So I think there is a need to step up those how-tos, invest in research, be experimental, be visionary. And secondly, I think aging cuts across silos and specializations. So it requires a holistic and collaborative approach because no one person has the skill sets to do it all, right? So we need to not just be gerontologists, we need to be planners, we need to be social service providers, we need to be well-versed in medical care as well, right? To understand the entire ecosystem and bring about that physical and social infrastructure that is necessary. Specifically for planning, I think there is a lot more need to make sure land uses are integrated. A lens where planning for longevity is sort of embedded into how we do the planning upfront, not have aging planning as an afterthought or something that's separate, right? This means finding ways through things like zoning bylaws, area planning, placemaking, housing policies that can encourage the intergenerational mingling, the co-location of services, and the living together, really, that is family-centered, but also very socially embracing, right? We want to encourage the kith ties to also form. And so a willingness to revamp old ways of doing, because when we invest in the urban environment upfront, I think there's tremendous trickle-down effects, right, on the physical, mental, social well-being of our seniors. And this translates into actually potential healthcare costs in the longer term. And I think even as we focus on the brick and mortar, let us also not forget the software, the programming that help foster care, and also what I like to call the hardware, the care ethos that enables caring to sort of magically happen, right? The carescapes.
That's wonderful, Dr. Khoo. And I love your theory of hardware and the carescapes, which I think is in one of your articles we've shared, if attendees would like some more information. And what resonated with me from what you said is bringing the solution forward instead of the problem. And how can we really make it data linked so that we can drive change? Thank you so much for speaking today. And on that note, we are going to next hear from Dr. Critchlow. Wait till see Dr. Critchlow on the screen. Hi, Dr. Critchlow. So you co-created a co-housing community for older adults called Harborside Cohousing, which is in BC, and you're also a resident there. Through your work with co-housing development consulting, you've also helped others achieve their goals of creating co-housing. So to start us off, what is a co-housing community, and what design and community aspects make them unique places to live?
Thank you, Lindsay. Can you hear me all right? Co-housing is a kind of collaborative housing that tries to overcome the alienation of so much modern housing, where you don't know your neighbor and you feel disconnected from the whole community. It's in a co-housing community, the most common features are that you have a complete private dwelling unit. It's compact usually in a multifamily development, that you have a lot of common space. So at Harborside, we have guest rooms and a suite for possible, we call it co-care suite for a possible medical attendant or a live-in caregiver of some sort. We have a gym, we have ping pong tables, we have an infinite number of puzzles, and so on. We have a lot of common space, and that's one of the key features of a co-housing community. And then we also have a neighborhood design, and it's designed for both privacy, all the privacy that you could want, and for community and lots of opportunities for casual social interaction, corridors where you're going to meet up with people, little nooks to gather in. And collaborative decision-making is the final quality of or main feature of co-housing. So we make our decisions at Harborside by consensus in monthly meetings. We work together in small teams. And one of the features that's really appealing and it's an older adult-oriented community. It's a senior co-housing community, and there are a few of these in Canada. But I would love to see more because it's an opportunity for people of my age to be involved in and making the decisions about the activities that they'll be doing every day. So we're not entertained by other people, we do it for ourselves. I think that it makes them unique places to live. It's the resident control that makes it quite different to the kind of place where I put my mother when she reached the point in her life when she needed care. And that was in fact what's inspired the starting of Harborside Co-housing was, ooh, I can't afford where she's going, and I don't actually want that. I wanted to be more actively engaged in my own aging process and my own housing.
I love that point, the self-directed, resident control, autonomy, but also having that increased opportunity for social interaction and community building, which I feel like is so needed in our modern society. In your experience, how are co-housing communities funded? What are ways to increase affordability?
Good question. And I see in the chat, there's a question, do the residents purchase their unit? And yes, they do, but they start that process at the very beginning of the development process. The future residents are the developers. So we put our money in and had to come up with at least 25% of the total project cost in order to get funding from a credit union for a construction loan. So we didn't include any profit because as the developers, we just wanted to build it at cost, working, of course, with professionals to do that. But the homes in co-housing are often higher quality and people want to include, and we did include, more green built features. So they end up costing, the cost is comparable to any new equivalent unit on the market. So in our case, equivalent to a new condominium in the town where this was built in 2016, which is when we moved in. What makes them more affordable is that they cost less to maintain. We do a lot of the maintenance ourselves. We do a lot of the management ourselves, although we do hire a company to collect the strata fees. But the green features make them much cheaper to live in. Hydro bills are very low, and the homes can be smaller in co-housing without negatively impacting lifestyles. So I live with my husband in 900 square feet and feels like we have tons of room. And we use the guest spaces, and the extension of our living room is our common house. So in that sense, we can contribute to the affordable housing continuum simply by the lifestyle that we choose, more than by, and to some extent by the design features. But there are no government subsidies at this point, and never have been, for co-housing. It would be great if there were, but that's not what happens here. So what increases affordability is if we can work with local municipalities. And we were able to do that at Harborside. We do that in some of the other projects that I'm involved with. And that, in our case, our whole project, which was 31 apartments, was treated as our contribution to affordable housing in our municipality. It wasn't that there were a couple of affordable housing units. They were all deemed to be affordable. And so that saved us money during the development process. I think there are other opportunities to reduce living costs, but they're mostly things like group buying and pooling resources, which we do informally living in co-housing, all of the co-housing communities. Ours is senior oriented, as I said. It's not age restricted. So we have sometimes younger families there, and there's no age restriction that I'm aware of in any co-housing communities in this country.
Thanks for flagging that. That's an important point. So you're really enabling that intergenerational community for those residents that might be interested, which is a wonderful wonderful component. So when we spoke, I learned that you're working to support the newest co-housing community, Victoria Harbour Co-housing. And many co-housing communities are started by grassroots groups of like-minded individuals. What advice would you give someone who wants to start a co-housing project where they live?
Thanks, Lindsay. I would say, this sounds self-serving, but I would say read our book. It's Community-Led Housing, a Co-Housing Development Approach, which I published with Renee Matthew, who's the principal author, last year. And it lays out a step-by-step approach to how to do it, to take it from, I have a great idea, let's get together with some friends and build a shared housing, to successful completion at a price point that is affordable to the people who plan to live there. Aside from that, then I would recommend that you just don't try to do it alone. It's great to get together a group of friends and have a potluck. That seems to be how they tend to start. And set your sights on what it is that you want to create and what the values are that you want to include in it. But don't get very far without getting some professional advice, because so many attempted co-housing projects fail because they don't ground their projects in reality. And we have 165 co-housing communities in North America right now. 23 of those are in Canada. 15 of them are in BC. And it would be great to see more throughout the rest of Canada. And I think the book actually supports the creation of more co-housing communities. That's certainly our intention. And with Victoria Harbour Co-housing, we're trying to coalesce a group to kind of invite people to come forward and become the founding group. So we started just a few at the very end of January, and we're building a wonderful base of members in that part of the world. So it's now on the cohousing.ca which is the Canadian Cohousing Network website. And I encourage anybody who's interested to look at that and get in touch.
Thank you. And we'd love to see more co-housing communities in Canada. And we'll definitely have to read your book. Wishing you the best of luck with the Victoria Harbour Co-housing project. We're nearing the end of our discussion. So as we draw to a close, how can we incorporate co-housing principles like community building and social connection into existing housing that's out there? Any thoughts you can share?
Yeah, I think it's quite possible. I mean, the built form of many multifamily developments doesn't encourage social interaction. In fact, it encourages everything but. So you can get from your car to your own unit without ever seeing another human being. If you have a building that has more opportunities for social interaction, start talking to people. Introduce a little bit of collaboration. Work together. If you meet together, do it collaboratively, even if you have a majority voting process. Hear from each other, listen to each other. I think in this time of polarized opinions, it's just the best thing we can do. And it also supports, I think, aging well. It keeps us curious about other people, connected with other people. And it's through those connections that we can really age in a lively, creative, and flourishing way.
I love those points. And I also really liked how you said that so many of the co-housing projects come about around a table with some food. So, go back to connecting with each other, conversation, fostering social interaction, and good things can come from it, like co-housing projects. So thank you so much, Dr. Critchlow, for your time. And next, we will hear from Dawn Harsch. We'll wait for Dawn to join us on the screen. Good morning, Dawn. So Dawn is president and founder of your company, ExquisiCare. You've designed, developed, and operate 3 small care homes in Alberta, which provide both housing and clinical care. We are also excited to have ExquisiCare as part of the SC Health family. Can you tell us about your small care home model and the integrated care? What is the experience like for the residents living there?
Absolutely, Lindsay. And thank you so much for having me. And just before I say that, I have to say, wow, I'm so honored to be a part of this and listening to Dr. Khoo and Dr. Critchlow and what they've done. And there's some themes here, and I think you'll hear that as I describe the small home model. So I'm a nurse. And when I started my nursing career 35 years ago, I worked in those institutional long-term care 200-bed facilities. And at the time, I thought, there is no way that I would want my grandparents or now my parents. And so I envisioned something different, something that encouraged that social connectivity, because it seemed striking to me that even in a building where there's 200 residents, the seniors could be exceptionally lonely and not connected to their housing mates or the people who live down the hall. So I created the ExquisiCare model. And what is it? It's an alternative to institutional long-term care, is what I like to say. I do not believe we should be institutionalizing our parents, our grandparents, our community's greatest treasures, full stop. Institutionalizing or warehousing seniors is not okay. And so I believe that we don't need to do that for seniors who need care. The ExquisiCare model, then, it looks like this. It is custom-built residential estate homes that currently have 10 bedrooms. You could go up to 12. Every senior has their own bedroom with their own attached ensuite bath and a walk-in closet, and then the rest of the home is shared. So it functions and it feels very much like a family home. And in fact, when you're walking down the street in Edmonton, you may not know that that's an ExquisiCare home right next to that family home. But there's 10 seniors who live there, and there is round-the-clock professional nursing care. And in Alberta, we have designations like SL4 and long-term care, and I'm sure there's similarities to that across Canada. Our clients at ExquisiCare are typically at that SL4, so they need a significant amount of care and even long-term care. So we do mechanical lifts. We even take our clients from all levels of care, so be that significant assisted living, up to and through long-term care and through the palliative stage. So we provide all the healthcare needs that they require within truly a family home. The staff do all the cooking. And, I loved what Dr. Critchlow said in terms of the importance of that social interaction, because those 10 residents who live there and their families, and even the staff, they really do become like an extended family of one another. And because of that, we see excellent results. You know, our average length of stay at an ExquisiCare home is close to 28 months, whereas typical long-term care, I would guess it's under a year now. I'm not sure of that stat. But again, so all levels of care in what is truly a residential home. We have a visiting physician, we bring all the services in, but we also integrate with the community. And so the neighbors in an ExquisiCare home, they will often stop by and visit and come over for coffee. I had one lady call me and say, you know, my grandparents are all in Eastern Canada, and so my kids don't have any elders. Can my children come over and play? Absolutely, we would love that. And when you ring the doorbell at an ExquisiCare home, it's often a client that answers the door because it's their home.
That feeling of home is so important, and not feeling like you're, you know, in a stale environment, but instead in a vibrant environment embedded in a community. How might small care homes be implemented in rural communities?
I think that's one of the great things about small care homes is because there's only 10 to 12 residents, it's better suited to serve smaller populations in rural communities. Typically, long-term care facilities have anywhere between 30 and 100, but 100 would be far too many for a rural community. So you could easily put a small care home in this town and another town, which is 30 minutes away, and another town 30 minutes away, and create a bit of a pod. There is some operational effectiveness when you create pods of these homes, so 3 or 4 within a geographical area. Generally speaking, the staff that are in one home, they stay in that home. And I'll kind of give us a plug here that during COVID, we had 0 cases of COVID. We lost nobody. We had no COVID. And I think that was just because of the smaller number of staff that came through, and also the commitment the staff had to the residents there. This isn't just a resident. It isn't just a number. This is, you know, this is Louise, who we've all known for 3 years. You know, we wouldn't dream. So integrating into a rural community, one, these homes can be built much faster as well. You know, when you look at typically the building permits and the zoning and whatnot for a bigger institutional care facility, it can take years to make that happen. These are typically zoned as a group home, and I can build them now in under 11 months. So we can get them up really quickly in rural communities. The other great thing about it, and we all know this, and it goes back to that social connectivity and being connected to your family. When you take a senior who's lived in rural Alberta and you say, you're going to leave Grand Prairie, which is kind of northern Alberta, and have to come all the way down to Edmonton, and we pull that senior away from the ability to see their family on a everyday basis, it impacts their health and longevity. And so keeping these individuals in their rural community is not only better for their own health and well-being, but it can also help some other issues that we have here, which is our ALC situation. So we've got a lot of seniors sitting in hospital, which is absolutely the wrong place for them. And so if we could build more small homes, which would service people who need long-term care in rural communities, we would really get them into a more appropriate level of care and faster.
I love that component, the balance of great quality care and also the speed, which we know and we've heard is very important. We have a lot of folks sitting on wait lists and unable to access higher levels of care. So a great solution for rural communities as well. So I've said to you before, I wish my grandmother in Ontario could live in one of your homes. So from a funding perspective, advocacy perspective, how do we get small care homes to become a more mainstream option? What are some of the challenges we need to overcome?
Oh, I wish your grandma could have too. The biggest challenge here really is around funding small care homes, because our staffing model is such a departure from traditional long-term care that we don't fit. And traditional long-term care and assisted living, I think it used to be that the minimum was 28 beds for it to make sense financially for governments. And I think that old way of funding, we just need to look at it as completely different, because even the staffing model in ExquisiCare or small homes is different. And we don't delineate the tasks of our staff the way we see in long-term care, where this is an RN and she does this, and this is an LPN and she or he does this, and this is what the HCAs do. It's really that multi-skilled worker. And so the old way of funding, where it's hours per day based on old antiquated sort of workforce measurement tools. We have to have a completely new way of looking at funding small care homes. And so I think that that's where the advocacy piece comes in, is, you know, individuals in rural communities, they need to say, this is an option that we want. And I do think that option and choice is part of the conversation. Small homes aren't for everybody. They are more intimate. Most people love them. We got great results in terms of the food and the recreation. Again, that social connectivity that we provide, but it's just about choice. And so I think everybody needs to advocate for wanting the ability to have that choice. And maybe some people say, I want to stay at home with home care funding. Maybe I want a small care home option. And maybe the bigger institutional care facility is what works for me. But really advocating for different ways of funding and understanding that our old way of workforce measurement tools and funding on a per hour, per day, long-term care, we have to think differently when it comes to small homes.
I think that's some really actionable things that we can take away from the pieces that you shared, the advocacy, like raising this forward in your local communities, helping to become allies, and working, you know, to bring this message forward to governments. I know we shared in the chat a recent interview you did with CBC about the funding in Alberta. So we're hopeful that this funding can be spread more so across other Canadian provinces.
Yeah.
Any final thoughts you'd like to share with the group? Any kind of hopes for the future?
Yeah. You know, when I started ExquisiCare, I really wanted to see this model expand across Canada. I think it is a great option for people that want it. I'll address some of the questions in the chat here, because I think they're really great questions. One is about NIMBYism. And just an interesting story. When I first started ExquisiCare, didn't have it on the first home. And on the second home, had some people come to the development application hearing. And once they heard what it was, we are at a point now in Edmonton where I get calls from communities saying, will you please put a small home in my community? So the NIMBYism has almost flipped, where people say, this is a beautiful way to treat seniors. We want seniors in our community. It's not a detractor for the community in terms of parking. The homes are beautifully maintained. And so I'm really encouraged by that people are seeing seniors as not something that they don't want in their community, but this is an option that they want for seniors. And so I think the narrative on seniors and small homes certainly is changing. The staffing model at ExquisiCare, is pretty simple. For 10 clients, there's 2 staff around the clock, or sometimes 3. So every day during the day, there's a nurse and a healthcare aide. You call them PSWs in Ontario. And then evenings and nights, there's 2 PSWs/healthcare aides. So we do all levels of care. We've got mechanical lifts. There's always a nurse on call. And I would tell you anecdotally, and so thankful that SE has bought ExquisiCare, because now we can start to do some really in-depth clinical research to prove these results. But I can tell you anecdotally that our results are great. You know, I worked in long-term care for a number of years as a nurse, and we have fewer falls. In 13 years, I've had 4 bed sores, and those were all on retired nurses who told us that they didn't want to be turned because they were dying. And so it's about choice, fewer trips to the hospital as well. And I think that comes from that close connection between that nurse who's there Monday to Friday, who knows her 10 clients exceptionally well, and is having ongoing conversations with the family about expectations and really educating the family. And so it is exceptionally rare that we send somebody from an ExquisiCare home to hospital, because after we have a conversation with family about what's going on and we talk about their goals of care, everybody's on the same page. You know, that communication back to family is so important. We all know that things happen in long-term care, and seniors sometimes fall. And one of the things that drove me crazy when I was a nurse working in long-term care is this family would show up and a mom would have a bruise, and they would say, like what the heck happened here? But if that family had been communicated right when that happened, they wouldn't be upset, and they would understand the reasoning behind. So one of the things that we're really proud of too is the partnership that our staff have with the families, because it is, the families know their loved one better than we do. But over time that may flip. And so we've got a very close and trusting relationship with families.
Having the families as the care partner, that relationship cannot be understated. So thank you so much for all of these insights, Dawn. We've come to the end of our first panel. So I just want to thank you, Dr. Khoo and Dr. Critchlow, for all your great insights. And I will now pass it over to Madonna Gallo, Chief Strategy Officer and Senior Vice President at SE Health, for our second panel discussion.
So much, Lindsay, and I likewise am buzzing with excitement, hearing about all the inspirational models, the things happening across Canada, and the paths forward as we consider this topic. We are looking forward to hearing from the Honourable Jason Kenney to kick off our next panel. There you are. So Mr. Kenney, you've had a successful career in Parliament spanning over 2 decades, including serving as Alberta's 18th Premier, as well as one of our volunteer directors at our board here at SE Health. Really appreciate you sharing your wisdom and expertise with us today and ongoing. We've really heard and know that collaboration from all levels of government is so key to advancing housing solutions. So in your experience, what action can governments take from a policy and funding perspective to support and enable more innovative housing models for older adults?
Well, thanks, Madonna. Let me thank all of the other panelists for their really practical and inspiring insights about how to address these enormous challenges. I can tell you as a former leader in government that there's no we're facing a lot of big challenges in this country, and none are greater than the aging of the population. We're just not ready for the demographic tsunami, and we're facing a general housing crisis as it is, housing prices that have doubled in the past decade, housing that has become home ownership, rather, that's become an unattainable dream for younger Canadians. Immigrants who are coming here who can't find or afford housing are going back to their countries of origin, and growing housing poverty. And then when you look at this from the perspective of an overlay on top of that, the aging of the population and the growing demands on adequate seniors housing and the care needs, it's kind of overwhelming, because you know what, there is a finite quantity of tax dollars. And I know that this is an important message I want to underscore for those in the sector. The notion that we can make a never-ending claim on the productive sectors of the economy through ever higher levels of taxation is not sustainable. You do that and you end up pushing wealth-creating people out of the country and suppressing economic growth, and you also end up with huge structural deficits, which means debt interest payments going to bankers as opposed to funds available for critical social services. So we have to do all of this, housing, healthcare, seniors care, in a way that is efficient and affordable, despite the huge demographic pressures. I don't know how we're going to accommodate all of that, but what I will point to are some success stories. I think, we just heard from Dawn, the flexibility of the funding model in Alberta that's allowed for innovation, like with the small homes. That's a wonderful, wonderful initiative, and I think exactly the kind of flexibility we need. Alberta was a fairly, I think, early innovator in being a funding partner because, I don't know, the political culture there, people are quite open to public-private partnership funding models. I think there are some parts of Canada where it's considered verboten for the government or government agencies to be partners with private sector operators of assisted living or continuing care homes. I think the Alberta attitude is that, in fact, private operators are typically far more efficient. And that's why Alberta many years ago created the ASLEAP program, the Assisted Seniors Living Initiative, which allows for provincial government capital grants up to a certain amount to fund the construction of assisted living facilities that are then operated by private charitable or nonprofit operators. And so it's a public-private partnership. And typically the homes built through the ASLI partnerships have cost almost half as much per door, per unit, as the government-built, government-operated facilities. So I think you're getting a lot more bang for the buck with programs like that. I think we need to, if we're going to maximize the increasingly scarce tax dollars, to increase the stock of seniors housing, then we need more public-private partnerships. One thing when I speak to operators, though, the one key point that I hear is the need for predictability. One of the criticisms in Alberta has been that from time to time, the parameters of the program changes from one government to the next, or when and the operators need long-term predictability in the terms and conditions of programs like this, so they can plan for them, bank on them, and not constantly be jerked around by policy changes. So one appeal I would make to both elected officials and public servants is the need to find a flexible model of public-private partnerships for building these kinds of facilities, and try to insulate it from political government changes, from changes through the election cycle. I think that's very important. Another point I would make is, we just heard about the problem of NIMBYism. This is a problem, obviously, generally with housing in Canada. We've seen, this past year, we've built something like 220,000 housing units in Canada, but our population grew by like 1.8 million. This is insane. This is not sustainable. And this is why we need all orders of government to be rowing in the same direction, in urgently focusing on housing completions. And municipalities have got to play a critical role in this. This applies as much to seniors multi-unit units as it does to single detached homes. They've got to get with the program in terms of zoning and approvals, and getting development costs, development charges under control. We've seen development charges assessed by municipalities growing by, in some cases, several 100%, much faster than the growth of the economy, the population, or anything else. And so one of the reasons we see a scarcity of new housing starts, including for multifamily, including for seniors units, is the development charges. So I think this is going to be a very big issue in the upcoming federal election, whether it's this spring or fall, we don't know. But I think, obviously our recent challenges with the United States will be a central issue. But apart from that, I think the biggest issue will be housing. And different parties are going to come to the election with proposals for tying federal infrastructure transfers to municipalities contingent upon getting development charges under control, but also increasing the pace of approvals and permitting and actual completions of new housing units, but most importantly, getting the density balance right. And that's where we need to push back firmly. We need senior orders of government, the federal and provincial governments, to push back against municipalities that are resisting higher zoning changes for higher levels of density. Because, when you bring a larger seniors facility into a community that where people simply want low density detached homes, there's often some friction. Well, we've got to explain to those voters, those local residents, that if they want to live in dignity when they're seniors, and if family care is not an option, if home care for them eventually is not an option, they're going to need facilities like this. So I think there's got to be some gentle but real pressure from the senior orders of government on the local municipal governments to increase for more flexible zoning for multifamily units, including in particularly for continuing care. I guess the last point I would make is that wherever possible, we also need to get munis to lighten up on zoning restrictions for modifications to seniors' homes. If we can make minor change and more funding for these kinds of modifications, if we can extend the ability of seniors to stay at home with supportive home care, and I know SC Health is brilliant at that, Canadian pioneers in this area, then that's less pressure on the continuing care system. I promise this is the last point, but something I learned in COVID, trying to oversee the massively stressed healthcare system, is a chronic problem in the Canadian healthcare system, which is, as you know, most provinces, something like 20% of the patients in acute care hospital beds are people who are ready for and would be better treated in home care or continuing care. So this is not just about housing. It's actually about how to save the healthcare system. God forbid we should ever face a situation like COVID again, but we had every province at one point or another essentially ran out of ICU beds. And that was in part because of the 1/5 of acute care beds that were occupied by typically seniors who could be better cared for in other situations. So that just underscores what I would say is the urgency of this. It's not just a housing question, it's also a healthcare question.
Thank you. Some incredible insights there, and sort of a recipe to some extent as we look at moving forward. You touched on sort of both the massive societal challenges that we're facing, but also how to reframe those as opportunities, the need for innovation, for efficiency, to really kind of get real with our plans and path forward. The magnitude also of collaboration across all of the various stakeholders, not only the levels of government, but public-private partnerships. And then really, which is a big theme of this panel and the event today, is the need to accelerate the pace through kind of new thinking, new approaches. I guess just any final words for organizations that are trying to push forward with this work and align a lot of these, different issues, stakeholders, to get the buy-in and move forward quickly. Just any words of advice that you would give to us in sort of next steps?
Yeah, I would say that the sector broadly needs to find a more united voice for a very clear message. Like, we've got a federal election coming up where housing broadly will be a central issue. But the aging aspect will just, I don't like, we need to elevate this in the public debate. Not as an afterthought, not as a secondary or tertiary question, but as a central question, because it affects every other area of public policy, such as healthcare, as I've mentioned. So I would encourage those who are in the sector on a national level to come together in an advocacy effort that focuses on some really clear positions and issues. And by the way, if the message is simply give our sector endlessly more tax dollars, probably not going to be a very effective electoral message at a time of growing tax fatigue and declining productivity as a country. So more efficient public-private partnerships, better and faster zoning, reducing the development charges. I know, like, let me be blunt. Most people in this sector reside in the public sector. Not all, there's a lot of private sector operators, but most are in the public sector with public sector thinking. And I would just encourage people in the sector in approaching advocacy to be innovative and to bring forward solutions that don't always demand ever increasing spending by governments, because that is a well that will has limited depth, if you will. So you got to focus on, I think, what can we do in innovative ways to get more housing stock built, while reducing the costs. And as I say, I think municipalities got a big role to play in that.
Thank you, Mr. Kenney. And that is the perfect setup for our next speaker. So continuing on the topic of funding innovative models, we will now hear from Andrea Nemtin, who is the CEO of Social Innovation Canada. Andrea, you are working to address complex challenges like the housing crisis to create transformational change. As we heard in the first panel, outside of traditional long-term care and affordable or supportive housing, many models of seniors housing are largely funded out of pocket in Canada. So what are your thoughts on how we can think more creatively about financing innovative housing for older adults? And what are the opportunities and financial tools that may help us spread and scale these models?
Thanks, Madonna. And so wonderful to hear all the panelists. There's amazing initiatives that are going on every day. And it's really inspiring to see the new innovative ways that people are doing things. You know, at Social Innovation Canada, as you said, we work on complex challenges, whether it's climate equity and the challenges of the increasing number of uninsured in our country, or reconciliation, or community wealth and prosperous communities, local prosperity. Housing and affordable housing has been one of our thematics that we've been working on. I've been working on it for about 4 or 5 years, 5 years now, I think. And we focus in really on the most acute challenges. So I understand we looked at the whole financialization. We look at a systems level piece, what's happening with the entire housing system, which is challenging. As Honorable Kenney, Mr. Kennedy said, I think we need about 3.5 million homes, in the next 3 years or 5 years or something by 2030. And 500,000 of those, just under 500,000, RBC recently reported, need to be non-market housing. And so for me, when I look at these kinds of challenges, specifically the one, when we put our housing challenge with our seniors challenge, with, all of our health challenges, there's often things that need 3 areas of changes that have to happen at the systems level. One is paradigms. How we think about aging, how we think about, individuals don't actually want to go into homes. What a big problem. Everyone I speak to, their parents don't want to go. And so this is one of the big challenges. So changing the way we think about how we want to age. There's all policies. So there's all kinds of, somebody mentioned, that in Ontario, I saw in the chat. So in Ontario, if you're going into long-term care, you don't get to choose where you go. You have to put, a list of 5 things and they put you somewhere. There is none of the autonomy and control. You are sort of managed into the system, as others on the call have pointed out. And I know that my mother's in a nonprofit home here in Ontario, in Toronto, that actually opted out of the provincial system so that they could have graduated care. So that when she's moved from retirement to long-term care, they don't have to ship her off somewhere else. Somebody that doesn't know her doesn't get to choose where she goes. So there's some real policy challenges with this. And I think the policy challenges are at both the investment and at the care levels. And then there's resources, funding and financing. And I'm going to talk a little bit about what we learned around how investment can be done in a way to increase the number of actual units in the non-market housing sector. And so some people call it community housing, others call it non-market housing, non-speculatory housing. This is the housing that has been created to supply housing, not to be creating profit. So nonprofit, cooperative, affordable home ownership, community housing. And that's the area that we focus on because we think it's really essential for addressing the big challenges in the market, the market's ability to get people out of the encampments, to be able to create affordable and comfortable homes for our seniors. The other challenges around policies, there's like silly things at the CMHC where they won't fund 6 beds. There needs to be 11 and they'll only fund one at a time. Or they won't, there's all kinds of little glitches in the system that create friction that are slowing things down. At Social Innovation Canada, we do an approach that sort of starts to identify some of those and then asks for them to be changed and experiments in new ways of doing it. So, I think that there are a lot of solutions out there around the financing, and I've noticed a few people in the chat, whether it's Tapestry or others, the financing challenges are that the non-market housing providers really need flexible, efficient, and affordable capital. They don't have the same kind of asset base. They don't have the same kind of revenue base. Their profits aren't going to be increasingly going up. So they need a different, they don't really fit into the traditional mortgage system or investment system. They do not want to return real estate type profits to investors. They can't afford it. However, I will say that when you're investing in non-market housing, the costs are 25% less generally. So they're very efficient. So what we've modeled is a private-public partnership for an investment fund. And that the model's been done in other jurisdictions across the US, across Europe, and actually in Canada, where you have a one-time investment from the government of public capital that allows you to create a revolving fund that is perpetual and sustainable. It's able to deliver the risk and return threshold to investors at a fixed income level, like lower, 5% sort of fixed income, like a term, and it's a debt, and it's able to deliver the flexible and efficient loans that are needed. So that non-market housing providers generally, in our experience, need very specific kinds of money. They need term loans that are very low. They need lines of credit that are easy to get and affordable. I think I don't have too much time, so I'm going to just wrap up with, there's always things that you can do. I think of things in fractals. So what can people do on the individual, the community, and the provincial and the national level? Like, what do we need on these 3 levels? And again, to Minister Kennedy's, somebody told me once that the feds have the money, the provinces have the control, and the municipalities have the problems. And on housing, the municipalities are about 54%, with the other, the province at 30 and the feds at 10. So I think on the individual, you can invest in community land trusts. You can invest in community bonds. You can get involved. You can model behavior. You can talk about new ways of aging and how you're looking to do it. And with your means, you can find something that's appropriate. At the community level, planning is crucial. You need to get in front of the land value uplift. When we do densification, all the land values go up and the non-market housing providers can't get in and they can't benefit from that. And at the federal level, we can invest in and the provincial level, they can invest and they can fund at the fund level that allows for autonomy in the regional place. They can also waive capital gains on the donation of real estate. This would increase the available land instantly for non-market housing providers and accelerate the creation of new sites. On the collaborations, my last note, I agree with Honorable Jason Kenney again, that placing seniors housing within the non-market housing conversation, within the supportive housing conversation, and asking for systems changes on that would be really beneficial. And I think it would actually allow for some lasting changes, would be able to create a more sustainable and healthy sector. Thank you. Sorry, I think I went over.
Thank you so much, Andrea, for those insights. I love how you spoke about the changing paradigm for the aging population and listening to what Canadians have been telling us for decades that they want for themselves and their loved ones as we grow older. And I also love that you've picked up on sort of the innovative social financing and growing interest and movement around impact investing and social capital here in Canada. It is a really exciting and growing space, and with federal dollars available, and increasing institutional investors. I know just in the town next to where I live, there also was a very successful program, Places for People, that was launched with the support of community bonds. So it is wonderful to see these new models taking root. So again, thank you very much for your perspective. We are going to move on. And next up, we have Dr. Cathy Bruce, who is the president and vice chancellor at Trent University in Peterborough. And actually, Dr. Bruce, I grew up visiting my grandparents in Peterborough, and I've always associated your city, your town, with both a very vibrant population of older adults as well as a university town. And so it's super exciting to learn that Trent is leading the way with the creation of the first university integrated seniors village in Canada. Can you share more about that project and what inspired Trent to get involved in housing for older adults?
Yeah, thank you, Madonna. I just want to say, amazing panelists. I'm learning so much myself, and it's really spurred some interesting comments in the chat as I've been following that as well. But so Trent University, near and dear to your heart, that's great. In Ontario, we have a keen interest and commitment to lifelong learning. So from the youngest to the oldest, we're all learners, and we try to embody that. So Trent has a growing expertise in research and teaching around aging. We have something called the Trent Center for Aging in Society, which is now sort of internationally level work that they're doing. And we are designated as an age-friendly university. And so a number of years ago, members of that research collective participated in an international study on promising practices in long-term care. At the same time, we're aware that Peterborough has one of the oldest demographic communities in Canada. This community also has one of the lowest housing vacancy rates in Ontario, one of the longest wait lists for care, long-term care in the Central East region of Ontario. So you take all of that into account. We thought, let's create a university integrated community of learning that meets the need for seniors housing, provides a place where students can develop skills, whether that's nursing, business, social work, for example, and provide a place where that research can flourish for the benefit of the residents. So we want to help design and test blueprints for best practices in aging well that can be scaled up. And as we're a university, we did approach the project somewhat from an academic lens. So we asked the Center for Aging and Society to create a report on seniors villages around the world, focusing on those connected to universities in particular, and to explore the academic and public literature on the subject and identify areas for innovation that Trent could pursue. So we designated a parcel of land on our Peterborough campus for this project. And just to say, it's surrounded by 55 acres of natural space and trails. There's 32 kilometers of trails. Just that alone has been very important to the Indigenous communities in this region, for example, wanting to have elders be embedded with nature. So we issued a request for proposals for a long-term care home to anchor the village. So we wanted a partner that would be committed to innovation and take student placements each year, build multi-purpose space within the home where community and campus could gather, but also have that integration back in. So it's a two-way flow. It's the seniors village connects directly to the university connects to the seniors village, and building that seamlessness there is really important. So we're pleased to have selected People Care to build and operate the home. It's a not-for-profit home, and to be our long-term innovation partner. So their vision aligns with Trent's goals, and now the plans for the home are progressing well. And I just say, at the same time, we've been preparing the land and working to identify a development partner for the rest of the village. A living, learning village that redefines, supports, and celebrates aging.
Sounds incredible. I mean, certainly multi-generational, multi-purpose, and also multi-impact. So as a sort of lifelong learning community, what are you learning so far in this journey, and what role can universities play in this work more broadly?
Yeah, we see this as a site for innovation where we can learn and scale up promising practices. So this idea that when we have a university involved, we can access grants, we can access private donor potential. We have a test bed for ideas, really. And so it also means, though, there can be continuity, because generally grants are multi-year and multi-pronged. So it's not just a quick in and out. There's this sustained relationship between the researchers and the students and the community. So partnering with the university allows us to do research that informs advocacy on a national scale, public policy to scale up those proven effective and efficient strategies. So like some of the ones that have been shared today on the panels. And so I think, universities are built for partnership and collaboration, and we have a capacity to bring together private sector, government, housing experts, aging experts, academics. We're pooling all of those ideas and resources. And so that's very exciting. Can I give you one example of a project, briefly? One of our faculty recently piloted an intergenerational classroom. So there were 13 older adults who joined a third-year class of psychology and aging. And I can tell you now, so many older adults wanted to join that class. It was incredible. The response was unbelievable. So these students and volunteers collaborated on assignments, class discussions, group activities, and the findings show so far that the project did have positive outcomes for both the students and the older volunteers. There was a meaningful intergenerational connection going on there, and through it, students demonstrated a more comprehensive, less fearful understanding of the aging process, while the older volunteers began to view the younger generation more positively, also needed, right? And that sense of hope for the future through the interactions. We literally couldn't get people to leave the room from that class. They just wanted to stay and keep talking, and they started making meetings outside of class just to continue on the relationships and the conversations. So the other thing I want to just mention there is that the research does show that early exposure to working with seniors and aging populations improves the chances of choosing a career related to aging. And we haven't even really addressed that whole career side of things, but we have such a high need. We certainly need people who are interested in working in aging. So we'll be working together to maximize student involvement in the long-term care home and in the village overall. We'll be holding classes there, creating learning placements, providing employment, both while studying and when students graduate. So we're also looking for ways to engage residents in the life of campus. So are they attending open lectures? Are they enjoying the beautiful shoreline along the Tonabee River? Are they seeing that multi-generational aspect of the village coming together? We have beautiful outdoor sculptures, lots of walking potential, that kind of thing.
Amazing. And it must be so exciting to watch this vision come to life, a really true learning system, which is such a bigger theme as well, not only in health or, thinking about a learning health system, but learning communities, learning education. It's a very integrated approach. And I know myself and so many of us here today would love to follow you on this journey and continue to hear highlights. We are going to now transfer. So thank you, Dr. Bruce. We are now going to transfer to our last speaker. Stephanie Allen is a real estate futurist with a track record for creating housing and is now supporting other organizations to engage in value-based real estate development through your organization, Adinkra Strategies. So I'm really interested to hear what you have to say about the future of innovative housing models for older adults. What does it look like, and what do we need to do to get there?
Yeah, thanks, Madonna. What a pleasure to talk to everybody today, and I'm buzzing from all the great ideas that this gathering is sparking. So thank you for setting a great table. The future feels kind of hard to imagine, I think, right now with the way things are looking. I started my career developing really small private assisted living homes. I've developed seniors housing in the nonprofit and government sectors as an executive at a nonprofit and at BC Housing. And I was an early community advocate for community land trusts, co-founding the Hogan's Alley Society to redress the displacement of a Black community that happened in Vancouver. And in the decades that I've been doing real estate development, the housing crisis is getting worse. There's all this incredible effort, but things are getting worse, and seniors are particularly vulnerable and are among the fastest growing demographic of homeless people in Canada. So what is the future? Well, I think despite this murky time that we're in, the future is going to be values driven, community accountable, cooperative. Look at the panelists and the attendees here today. I've been following some of the chat. Like, it's data driven, it's cooperative, things like cohousing. The ExquisiCare model for long-term care is intimate and communities focused. It's the community bond financing. It's nonprofit. It's collaborative. Community land trust. I love Trent University's living learning villages. Like, I think we all just really felt our heart burst with that, Dr. Bruce. So the future is this return to the village. It's a return to interdependency, shared prosperity. In my African ancestry, elders are valued members of the community. And just like it takes a village to raise a child, we know that African proverb, it takes a village to care for our elders. None of us want to be isolated with only people our age when we grow older. We deserve to be nested in our communities, with our lives enriched with our cultural and social customs in ways that nurture interdependence versus independence, mutual aid versus everyone for themselves, and the economics of sharing instead of extraction. The future must also be, innovation grounded in values and accountability, just not tech for tech's sake alone. Look what that's doing around us, right? The future won't be charitable. It will not be giving back. It's going to be taking less. And that's why cooperative and nonprofit models are so important right now and need to scale. Many of the people here I see are nonprofits. Look what this group of people are accomplishing, like without a profit motive. So I really reject this notion that humans are more motivated by profit than they are by love, and how that's a really grounding and organizing principle. And finally, for me, the future looks like following Indigenous leadership on how to respect the land and how to be accountable to the ecology that they have stewarded successfully for thousands of years and have maintained, and yet we can see how the systems we currently have are taking them apart. So, yes, there's a backlash that's happening on concepts such as equity and inclusion, but that's coming from people who are able to imagine that when everyone thrives, everyone's life gets better. So I think it's also on this type of table that you're setting that we're rejecting this. This is not us. Our values are going to be what guide us. Now, how do we get there? This is where the rubber has to meet the road, right? Adinkra Strategies, was founded to deliver our own projects, but also to support and partner with communities and organizations that are ready to reimagine this future of real estate and community planning. Our vision is to live in a world where everyone can live where they feel loved. And we are bending the development supply chain model to meet that goal. So instead of accepting the status quo, we're taking apart the housing supply chain, we're examining every component, and we're looking at ways that can bring us closer to our goal. There are many models discussed here today. These are breaking the barriers. They're breaking the old financial expectations that land development and real estate development that, let's be honest, grounded in colonialism have done, and where that's all leading us. And to meet those affordability realities that are facing so many people. Getting there is going to require an evolution at the systems level. So really social purpose investment at scale, strong government investors. Let me be so bold as to say, billionaires in this country can and should pay their share back into the systems and that they have taken from, and that those funds should be invested in communities of care. You know, I don't accept that we can just wash our hands and say taxes are too high. Absolutely too high for some people that are struggling, but for others who have more money than their children's children will ever spend, no, I just don't accept that. You know, and the evolution can also happen at the community and the project level, where strong partnerships and collaborations are vital to overcome, you know, the kinds of issues that are facing us. It's going to be all of us working together.
Thank you. It's so inspiring. All of those guiding principles, I think, that resonate so strongly with all of the panelists here today, all of the organizations that are represented. And just a follow-up question in terms of, you know, you describe yourself as a real estate futurist, and yet, you know, many aspects of this is already happening today. Can you comment a little bit further about kind of how you see the timeline or the horizon in shifting from sort of the current paradigm to more of a cooperative, interdependent, anchored in the sharing economy, anchored in sustainability and Indigenous wisdom, and kind of what are the key levers to really, again, accelerate that pace?
Yeah, it's a great question. I think, you know, it is accelerating. It's a time that feels quite doom and gloom. I get that. I have my moments of doom scrolling as well. But I think the shift in the paradigms that are happening, and as we see infrastructure crumble, institutions are crumbling in front of our eyes south of the border, and we see there's an appetite for certain people to take advantage of that here. As those systems are falling apart, we are, all of us, I see it in the chat and I see it among my co-panelists, we're dreaming of a future. We're putting those mechanisms in place. You know, at Adinkra Strategies, we've developed this process to partner that we called Pause, Dream, Plan, Move. So pause is taking a beat and recognizing that we got to check in. Our humanity is necessary to keep us going, and we can't do the work from a place of burnout and exhaustion. Like, that's not working. We must have our humanity intact, and we must have the resources. I heard Dr. Gabor Mate say, you know, burnout comes when you run out of fuel. A fire burns out when the fuel's gone. And so we need fuel, and that fuel is the medicine that we have in our relationships, in the love of our communities, and in the love of people who have shared vision. Then we talk about dreaming, like, let's use our imagination. I refuse to accept what people are telling us, that the limits are, and here's your boundaries, and this is the box you're in. Forget that. Like, we have to go, okay, what are our values? What are we accountable to? And then really dream of the future that we want to live in. And then so just that dream space is so missing when we're exhausted and we're running around, and all of us are taking care of families. I was just caring for my mother towards the end of her life, and she lived in a care home that was not like the one that ExquisiCare described, but they were doing their best. And so, you know, we're like, you know, we're kind of defueling. So I think we need that dream space. And then when we look at the data, we pull together the data. Where have we been? Where are we going? What matters? What can we take with us? What should be left in the past? Then we build a plan. You know, and from that plan, we are using analytics of the data. We're using performance metrics. How are we going to be held accountable to one another? And then with that plan, we can move ahead to where we're going. And it's an iterative process. It's a circle. We're going to come back and pause. We're going to dream again. We're going to plan. We're going to move. And I think that organizations building their strategies around that, and then finding the collaborations. Like, yes, it's hard to get financing for one project. Very hard to find good interest rates. But if your city, if your region, if all of you came together and said, who's building right now? Here's the little government pot of money. Here's our need. How do we work cooperatively that says, okay, certain groups are going to get that pot of funding. The rest of us are going to go door knocking, and we're going to find sources of capital, and we're going to harness the power of social purpose investment. We're going to harness the power of motivated foundations, and we're going to bring that capital into our community. This is the way we're building forward, you know, and it's super, super exciting to me to see how we're engaging as citizens, as residents, to take care of one another.
And I think that really is what strikes me from both your remarks, Stephanie, as well as all of the panelists today, is even though we're talking about sort of building and scaling housing, what we're really talking about is building community, building care, building connection, and building sort of these national vision and values for our future and for the care of the older adults. And it does affect all of us. At one point in our life, either through sort of grandparents, parents, other loved ones, ourselves, our children, our children's children to come. So thank you for inspiring us. Stephanie, Mr. Kenney, Andrea, and Dr. Bruce, what an incredible panel. We've learned so much from all of your remarks and your experiences. We do invite the audience members to note any takeaways and share them with us in the evaluation survey. I'm now going to pass it back to Tazim for some final comments.
Yeah, I think the operative word today for me is wow. But, you know, I have literally a couple of minutes and I do see people are jumping off. So I'll just say a few words. You know, we started out with the question of dreaming, and this wasn't planned, but Stephanie, thanks for bringing it full circle that dreaming is important. And one of my couple of takeaways were that the various models not only are giving, alternative options, but they generate different types of outcomes, different types of attitudes about aging, intergenerational connections, and affordability through different types of partnerships and innovations. So, that was kind of interesting. And the whole discussion that we just had on values-based, that's really important. And I think all of us, this particular slide, identifies the many roles that many of us can play. Some of us can play in some of these roles, and some of us can play in many of these roles. But also to elevate the discourse at the national level, as was suggested, and things like public-private partnerships and the kinds of policy changes that are needed. But also innovation in how we do advocacy and how we can be effective allies to bring about change. So, I encourage you all to, think about what you've taken away. We are going to be sharing the recordings, so, would like you to perhaps, share with others, have your own dialogues. But where possible, let's reconnect and chat about this. So we certainly, all of us, have a role to play as individuals and organizations to help spread and scale innovative models. So just very lastly, as we approach to the end of our event today, I'd like to take the opportunity to thank all our incredible panelists for sharing their time, their expertise with us today. Our wonderful moderators, Lindsay and Madonna, thank you so much. And of course, all of you for taking the time to join. I hope you found this helpful. A couple of things, stay tuned for an email that will come to you with today's webinar recording link and resources that were mentioned during the webinar. I also invite you to stay connected to one of our podcasts called The Future Age. It's available in all platforms. And there's been a recent episode dropped on small care homes, which you might want to take time to listen. And then just very lastly, thank you to all our people in the background working away to make sure all of these things, logistics, go well. A particular thanks to Dana. Dana has been in connection with many of you, so Dana has been leading this work. Thank you for taking this on, and for all of you for participating. Take care until next time.